This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubeda Hamid, your host for today. A recent study conducted in the UK found that paracetamol, a common over the counter medication, can have serious stomach, heart, and kidney complications in senior citizens who take it repeatedly. Constant use of paracetamol was linked to a 24% risk of peptic ulcer bleeding, a 19% risk of chronic kidney disease, and a 9% risk of heart failure. This is not the first time the overuse of paracetamol has been linked with adverse health effects, but it continues to be a medication that is commonly bought and often used without strict consideration given to the dosage that is being consumed. What does paracetamol do to your body over the long term? How can you use it appropriately? Are drugs in India being used rationally or are they being overprescribed and overconsumed? What does overconsumption of medication do to the human body? We discuss these questions and more with Dr. Sangeeta Sharma, professor at the Institute of Human Behavior and Allied Sciences and honorary president, Delhi Society for the Promotion of Rational Use of Drugs. Hello and welcome to the Hindus in Focus podcast, Dr. Sangeeta. Doctor, could you explain to us this new study that finds that the long term effects of paracetamol can be harmful?
Yes, paracetamol or acetaminophen, these are the same names, but some countries they call acetaminophen, some countries they call paracetamol. In India, we very often use paracetamol, generic name. This is a very good fever reducing medicine and also has good pain reliever activity also, and very commonly used for management of all kinds of fever in both children and adults. Sometimes patients use this medicines on their own without supervision of a prescriber, because this is generally available over the counter. They can get it from the pharmacy, and whenever they have pain, they get these medicines. There is a defined dosage for acetaminophen. For example, you cannot take more than 500 to 1000 milligram per dose, and there are maximum 4 doses in a day that you can take. But what happens is, sometimes fever does not for example, if you are using this paracetamol for reducing fever and the fever does not come down, and especially if it is a child, the parents get anxious about it, the fever is not coming down, so they may repeat the dose of acetaminophen before 4 hours. Because when we say, in supervised paracetamol dosages, we say should not be repeated more earlier than 4 hours. Best is to give a gap of 6 hours between the dosages, but if you have to repeat it, but not less than 4 hours should be allowed. So but in this case of fever, because they get anxious, panicky about it, so they may repeat. So this may go on if the fever is continuing. So this is one way that the overdose of paracetamol happens. Secondly, sometimes because this is available over the counter and it is used as a household remedy, they may be getting this paracetamol in different dosages, formulations also, because there are many multi ingredient medicines also. We call this as a fixed drug combinations, which are available in the market for common cold and flu. These preparations are available. So sometimes paracetamol is also one of the component of this multi ingredient combination. So knowingly or unknowingly, overdose happens because you are taking paracetamol alone as also and as part of this multi ingredient. So that's another situation where overdose happens. Then thirdly, in children, people use this syrups are used, and they use household spoons for measuring the dose of paracetamol. And as you know, kitchen household spoons, they vary in sizes. They may vary from 3 ml to 7 ml. Sometimes they may be using a bigger one. Usually when we say 1 teaspoon full, we mean 5 ml. But if you are using a bigger or a smaller kitchen spoon, then the dose is accordingly altered. So we are worried about the overdose when, for children, if you don't use the measuring cap or a calibrated oral syringe for measuring the exact dose. So this is another situation where the overdose may happen. Lastly, for adults, sometimes for our arthritis, paracetamol is also used for pain reliever because this is gentler on stomach. It has side effects, but like other painkillers, but effect on the stomach are gentler as compared to other pain relievers. When I say effect on the stomach are gentler, means acidity. A common language may people call this the acidity. So this is lesser. But again, if the dose is more, because pain relief is not there and the patient may increase the dose on their own, so toxicity or overdose may happen. Then another situation where this kind of overdose happens is if the patient is alcoholic, liver condition is not good. So again, the metabolism or the disposal of the paracetamol in the body is affected. So it may accumulate and it can lead to liver side effect. It can, or if you take this dose, more dose for longer time, it can affect kidney also. It can affect stomach acidity also. So many of the people have this feeling, misconception that the paracetamol is safe and any dose can be taken. So but which is not true. It has to be taken under supervised conditions only. Then I think this is a very good study, the clinical practice research data link study from UK. They have a good record of the number of acetamin prescriptions and the doses prescribed. So I think such kind of reports are eye opener for people, because they, here you are coming up with an evidence that, see, if it was prescribed to so many people and these were the side effects seen in these people. So people get conscious and they can use these findings to improve their prescribing practices for paracetamol.
As you said, doctor, it's a very common over the counter drug, correct? So, is it very important to be able to read how many milligrams you're consuming?
Yes, definitely. Because as I said, there is a maximum dose prescribed for paracetamol. Maximum dose for an adult is 4 grams a day. That means you can take 4 doses of paracetamol 6 hours apart. But when you come to, some people may be taking it as and when required. So they may be taking 1 dose or 2 doses in a day. So for that, the prescribed dose is 500 to 1 gram per dose. So one should not exceed this. Now, one more thing I would like to mention here is, sometimes when I mentioned about multi ingredient combinations, and in India, we usually used to have 500 milligram of paracetamol tablet. Then this Dolo 650 milligram tablets came. So usual when we say 4 doses in a day, this was according to 500 milligram per day. So 4 doses of 500 milligram tablet. But if somebody is, people don't have this knowledge, so they may be using this 500 milligram tablet and 650 milligram tablet interchangeably. So if the patient is taking 650, so that means if you take 4 doses in a day, so it exceeds the maximum limit for paracetamol. So this is one issue that we are facing clinically. 650 milligram, there are some defined indications and that should be taken under supervision of the doctor. A patient should not be taking this medicine on their own. Now we have seen, common practice, this 650 milligram paracetamol has become a household product. Even for simple fever, which can be easily brought down with 500 milligram, we have seen people using 650 milligram, which is unnecessary, and it does amount to irrational use of medicines.
How would you know that it's become that there is toxicity? How do you know that it's going to be? How do you know that it's affecting your health?
Yes, it is. You can find, the patient may be having some symptoms. Loss of appetite may be there. There may be pain, sweating, decreased thirst, and if the overdose is happening over a period and it is affecting liver, then jaundice may happen. So one can then, at that stage only, people come to know that it has affected the liver.
What are the other effects apart from the liver?
It also damages the kidney. So over a period, we call this, acute renal failure may happen. The person may start retaining fluids. The kidney function test parameters, they become derailed. And over a period, if it is continuing and if the patient is having other concomitant problems which are affecting kidney, it may become a chronic condition. So they will have difficulty in metabolizing these, and the fluid will retain. Kidney cannot function, cannot handle that much of fluid. So fluid retention happens, and then patient may have a breathlessness, and because of the fluid retention, those symptoms can appear, but then that becomes too late for that. So initially, if the paracetamol overdose is happening, if there is a fluid retention, one should become cautious about it, that something wrong is there. Generally, it will worsen the hypertension because of the fluid retention. So hypertension control may be also affected by this.
Is it more common in children or in older adults?
As I said, it happens in both the age groups. Children, I told you that one of the reason is because the parents are not using the calibrated device for measuring the dose. So if they are not measuring the dose correctly, if they're using household kitchen spoon for this, this is bound to happen. And also this is seen in elderly, because the way they metabolize, their body function after 60 years changes. The capacity of the liver, kidney, it changes in elderly, so they cannot handle excess amount of paracetamol. And especially those patients who are alcohol, who regularly take alcohol, and this can be exaggerated. All these effects will be exaggerated in those patients.
Talk to us a little bit about the use of drugs, the rational drug use in India. Overall, what is the situation, doctor?
uh, this is not so good in India. We see a lot of over prescribing. We call this as polypharmacy. When we can manage with one or two medicines, we see, multiple medicines are prescribed to deal with one particular condition only. Then we find that a lot of antibiotics are prescribed where they are not indicated. When I say that, I mean for viral illnesses, which are very common, like common cold and flu, watery diarrhea. These are viral illnesses. We know that there is enough evidence that 90% of these illnesses are caused by viral infections. So antibiotics don't work on these viruses, but we see that very commonly, almost 80 to 90% of the prescriptions will have antibiotics, just in case that it is a bacterial infection. We've seen this very commonly happening in COVID pandemic. Even when the test for COVID was positive, patient was having mild illness, people were so panicking about this. A lot of this azithromycin was used, which we generally don't use. We use this sparingly, because we want to preserve. This is a very good antibiotic, single dose antibiotic. And it is effective against many infections like typhoid, pneumonia. So we want to preserve these medicines, but we saw rampant use of azithromycin during COVID, just in case that the patient may be having bacterial infection. Then painkillers we have already talked about. Then the fourth drug that I would like to mention, and this has also attained a quite a huge magnitude now, is use of this proton pump inhibitors like omeprazole, pantoprazole, acidity. People call this as acidity ka medicine. You know, almost all prescriptions are having these omeprazole or pantoprazole like a group of drugs. And short term use is okay, but what happens is, especially the elderly one or those who are on pain relievers, if they continue to take this over a long period of time, this can be harmful, because acid in the stomach is our defense mechanism. Nature has given it. This acid in the stomach is used for assimilation, digestion of the food, and it protects the lining. But if you change the pH of the stomach by giving this long term omeprazole or pantoprazole, it will have long term effect on the harmful effect on the people. But majority people think that this is harmless. And whenever, another very common practice is, whenever they prescribe any pain reliever, they will prescribe omeprazole with that. So that's not warranted. These painkillers preferably should be taken after meals to reduce the acidity side effects. But if required, then you can use this omeprazole, pantoprazole, but not for all patients and not for indefinite periods. One should try and see and wean people from this pantoprazole.
So, is the problem, you would say, in from the medical professional side, or is it that patients are also asking for, say, antibiotics for quick relief?
It's both sides. All stakeholders are to be blamed for this. I mentioned about the prescribers, because whenever they have any diagnostic uncertainty, whenever they are not able to differentiate whether this is viral or a bacterial illness, they may use this as a just in case this is a bacterial infection. So that amounts to overuse or misuse. And we also define a particular duration dose for a treatment of an infectious disease. And if you don't complete the course, if you or you take it for a prolonged period, both are bad. So nowadays we say shorter therapy should be. So if the prescriber is not sticking to those guidelines for prescribing antibiotics, sometimes they may where doxycycline, which is a excess group of antibiotic which may work, but we are using azithromycin, which is a watch group antibiotic, where we want to preserve that. I mentioned to you about the COVID-19 pandemic situation. This is what happens. If at all you had to give an antibiotic, doxycycline would have been better than azithromycin. So these are at the prescriber end. But when we talk to the prescribers that why did you prescribe antibiotics, very often they mention that the patients come and demand for it. If I don't prescribe them, they will take it on their own. They will buy it from the over the counter, or some family member in India that is quite prevalent, sharing of medicines or using the leftover medicines from the previous illness. Last time also I had the same symptom, so it worked on me. So this time also similar symptoms, so I may take these medicines. So it's from the both sides. You cannot blame one person here. But I always tell the patients, they should be aware, don't not to demand for it. If required, doctor will of course write an antibiotic. Don't demand for it. Or if you think the doctor wrote it and you never asked for it, I always tell them that whenever you have a consultation, ask them if there is any antibiotic prescribed in it. And if there is one, then you can question the doctor, why, what for. Can we wait for some time? If the symptoms do not improve, perhaps we can add this antibiotic later. We call this what waitful waiting, watchful waiting for antibiotic prescribing. Here you tell the patient that right now you don't need antibiotic, it looks like a viral infection, it should get all right on its own in some time. If the symptoms do not improve or it gets worsen within 3 4 5 days, then you can come back and we will prescribe antibiotics. So these techniques help in managing both the patient's condition and the demand part, and the patients also get benefited from it.
But what about pharmacists? They also give it, right, over the counter?
Yes, definitely. Whenever this is a big, huge problem, because over-the-counter dispensing is largely, unregulated. Although there are enough regulations for this in India, all medicines are prescription medicines. They should dispense only when they have a proper prescription for it. But we know practically we can get anything and everything over the counter. So many people have this idea, they will go to a pharmacist, tell them their complaints, and then they will give these medicines, and many times this includes antibiotics as well. So they are one of the sources. They have their own reasons, and patients have their own reasons. For patient, it is a question of easy accessibility. Sometimes they rationalize by saying, it saved me a visit to a doctor. I did not have to spend a day or a consultation, pay a consultation fee for it, and ultimately doctor ने भी तो यही देना था. So there are this kind of logics given by the patients, and the pharmacist many times they don't know. They learn by the prescriptions, common, maybe somebody who is very popular in that region, and he keeps seeing those prescriptions. So from there they learn that okay, when the patient have these diseases problem, this works. So another irrational practice which happens over the counter is, the doctor may have prescribed 1 2 3 4 drugs, and the cost of the prescription would be X amount. And suppose the patient does not have enough money to buy the entire prescription, what happens? They either ask the pharmacist to dispense for a day only, or dispense something which fits in with the money available with them. So what happens is, when they do this kind of adjustments, the most important medicine in the prescription gets left out. The patient does not get that medicine, or gets it for 1 day or 2 day duration only, so they are not able to complete the entire course for it. So that may, especially if it is an antibiotic, we are concerned about it, because if you start feeling better, or if you don't have supply of medicine for the entire course, it may leave the infection incompletely treated, and they become more resilient, and they may come back, and we are worried about this antimicrobial resistance. In that, if this has attained a tremendous magnitude now, to the extent of that it has become a major public health problem. We see that we have a lot of antibiotics available with us, but they are not effective. People are dying because of severe infections or healthcare associated infections. So hospitalization is prolonged, cost of treatment is going high. So these are things that we are worried about, and we need to take care of this. So certainly pharmacists have a great role here to play, to promote rational use of medicines.
Last question, Doctor. What is the government's stance on this? What has the government of India done to promote rational use of medicines? What does it say in the national health policy? And how is the national list of essential medicines involved in this?
Yes, certainly, government, we have good regulations in place to take care of these, but implementation is a big problem. Regulations are as good as its implementation. Currently, because of the shortage of the infrastructure, human resource, this regulations are not effectively implemented. For example, for antibiotics, there is a schedule H2. There are about list of few antibiotics and few anti-tubercular drugs and some sedatives there in that list. They should not be prescribed, dispensed over the counter without a prescription, and a pharmacist is supposed to keep a record of it. But even today, after enactment of this schedule H2 for more than 10 years now, awareness and adherence to this schedule H2 is quite weak. That's one part of it. Then the government of India has a national patient safety implementation framework. We adopted this in 2018. This framework was to work within 2018 to 2025, and here six strategic priorities were identified. Out of this, medication safety was one of them. So we need to make a India has to move from this framework to operational guidelines. People are working on it, but it should be expedited. It should be operationalized. How this will be achieved, these priorities will be achieved, uh, operational plan should be there. Then third thing that is in place is essential medicines list. We have national essential medicines list. The purpose of this national essential medicines list is to guide manufacturing in the country, to guide procurement, and to guide prescriptions. So it is being revised from time to time. But the problems that we face is some of the drugs, medicines which are there in the national EDL, some of them are not being manufactured, so availability is affected. Or this essential medicines list is also used for pricing of these medicines. So all those dosage formulations which are in the national EML, they come under the price control. So that's one advantage the government of India tries to give to the consumers, that their price is regulated, so they fix the MRP for that. Now, but what happens is, if the regular audits of this pricing and the availability does not happen, sometimes the simple, effective, cheap medicines which will work for good for the patient, they are not manufactured by the industry, because there is not much return on investment for them. They don't find it profitable, or there may be, they say that the demand is not there. Some penicillin is one very good example of that. Then second is, for pricing, when they include all the drugs in the NEML for pricing, some unscrupulous people, or some brain wave, you may call this, they may find, the industry may find ways to circumvent this price control. One of the example is paracetamol here. Paracetamol 500 was under the price control, 650 was not. So that's how the 650 came into the market. Now the price control department has included 650 also in the price control. So these things, these are very dynamic things. You need to keep track of what's happening in the industry market, how the people are going, and keep matching these policies to promote rational use of drugs.
Thank you so much for speaking to us today, Dr. Sangeeta.
Thank you, Deborah. It was nice talking. This is a very important subject. I think
Absolutely.
through this podcast, people will, be mindful of use of simple looking paracetamol, but if not used properly, can lead to problems. I always say,
Or any drug at all, right?
yes,
Any drug at all.
medicines. I always say they are double-edged swords. If they have effects, they have side effects too. So you have to use them wisely in a proper dose.
Thank you, Doctor.
Welcome.
In Focus will be back soon. with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.